Ever thought about how your body handles all those pills and potions you take? It's pretty amazing. Everything you ingest, whether it's medication, supplements, or even a sneaky snack, has to pass through your liver. But did you know that sometimes these substances can actually harm your liver? It's called drug-induced hepatitis, and it can happen right away or even months later. See, your liver is like your body's ultimate filter. It works tirelessly to eliminate all the chemical waste and toxins, keeping you healthy and toxin-free. But here's the thing, while your kidneys can bounce back from acute failure with some help from dialysis, if your liver gives out, there's no backup plan. In the US alone, over 2,000 cases of acute liver failure pop up every year, and guess what? Half of them are because of medications or supplements. Some meds are more harmful than others, and we'll get to those in a bit. But first, let's talk signs. How do you know if your liver's taking a hit? Well, stomach pain, fever, nausea, dark urine, they're all red flags. And if your skin's turning yellow, or you're feeling unusually tired or itchy, your liver might be trying to tell you something. Now, here's the tricky part. How long does it take for meds to mess with your liver? It varies from person to person, depending on factors like dosage, age, and any existing liver issues. Generally, though, symptoms usually show up within a few days to a few months after starting treatment. Now, I know we're focusing on meds here, but let's not forget about alcohol and illegal drugs. They can wreak havoc on your liver too, with alcohol alone accounting for about 10% of all liver transplants. If your doc's given you a prescription, don't just toss it aside. Stick to their advice, even if it means taking those pills you're about to hear about. Trust me, they're not all bad, but some can really do a number on your liver. So, let's dive in. I've got a list of the top 10 meds that can mess with your liver. 1. Diclofenac. Let's talk about diclofenac for a sec. You know those anti-inflammatories like ibuprofen and naproxen? Well, they all come with a tiny risk of causing liver damage, but here's the thing, diclofenac takes the cake when it comes to being a bit tricky on your liver. The not-so-great part? These potential liver issues might show up weeks or even months after you've started using it. So, it's not just your kidneys that could feel the impact, but your liver too. A study published in JAMA Internal Medicine in 2014 concluded that diclofenac is associated with an increased risk of complications and liver damage compared with other NSAIDs. 2. Amoxicillin Plus Clavulin. Let's chat about Amoxicillin Plus Clavulin for a minute. This combo is like a superhero in the world of antibiotics, tackling sinusitis, tonsillitis, pneumonia, and urinary tract infections like a champ. But, hey, there's a bit of a catch. Despite its effectiveness, there's this concern hanging around, and it's a serious one: acute liver injury. Yep, it's a sudden thing that can mess with your liver, and trust me, that's not something to take lightly. A study published in the Journal of Antimicrobial Chemotherapy in 2018 reported several cases of bacterial infections and liver damage associated with amoxicillin and clavulinate use. So, if you're on this medication for a while or rocking the high doses, here's the heads up: keep an eye out for signs like yellowing skin or eyes, dark urine, extreme fatigue, nausea, vomiting, or belly pain. Don't hesitate to reach out for medical help pronto if any of these pop up. Your liver's a vital player, and we want to keep it in the best shape possible, right? 3. Amiodarone. Let's talk about amiodarone, or cortisone as some folks call it. This med is like the go-to for cardiologists dealing with wonky heart rhythms. It's super effective, giving those arrhythmias a run for their money and even tidying up those 24-hour heart monitors. Amiodarone's got a bit of a wild side. Yep, it's got a laundry list of potential side effects, from messing with your thyroid to causing lung and skin issues, and yes, even poking at your liver a bit. Because of all these possibilities, doctors are being a tad more cautious these days. They're saving it for those cases where the benefits really outweigh the risks. A study published in the American Journal of Cardiology in 2019 evaluated the risks of amiodarone to the liver and concluded that monitoring of liver function is important in the management of patients taking amiodarone. Now, don't freak out too much. Amiodarone doesn't usually go for the liver right out of the gate. It takes its sweet time, weeks to months even, before any liver troubles might crop up. But hey, it's always good to keep an eye out, right? For allopurinol. If you're dealing with high uric acid levels or battling gout, sometimes tweaking your diet just isn't enough to keep things in check. That's where allopurinol swoops in. This little guy works wonders at slashing those uric acid levels and keeping those gout attacks at bay. But, hey, here's the thing to keep in mind, allopurinol isn't all rainbows and sunshine. Nope, it's got a shadow side too, especially when it comes to your liver. Sometimes, it can throw a curveball your liver's way, and it can happen fast, like within days or weeks of starting treatment. So, if you're jumping on the allopurinol train, keep your doc in the loop and make sure they've got an eye on your liver health. Regular check-ins are key to catching any hiccups early and tweaking your treatment as needed. But don't let the risks scare you off completely. Allopurinol's still a lifesaver for many folks dealing with gout or high uric acid levels. It's all about finding that balance, right? 5 anticonvulsants. Anticonvulsants, like phenytoin, you might know it as Dilantin, and valproic acid, Depakine, can be a bit tricky. Phenytoin might start throwing punches at your liver right from the get-go, while valproic acid's effects might take a bit longer to show up, anywhere from 1 to 6 weeks after you've started the treatment. Keeping tabs on your liver is crucial. Regularly checking those liver enzymes is like giving your body a little health checkup. And guess what? It's not just phenytoin and valproic acid playing in this liver game. There's also carbamazepine and lamotrigine in the mix, though they're a bit more low-key when it comes to liver risks. So, if you're on any of these, just keep an eye out for any unusual signs your body might be throwing your way. We're all about looking out for you. 6. Methotrexate. It's a pretty common medication used to tackle all sorts of stuff, from rheumatoid arthritis to certain types of cancer. But here's the thing you gotta know, it can be a bit of a double-edged sword when it comes to your liver. Yep, liver injury is a real concern with methotrexate. It can range from just a little bump to some serious damage if we're not careful. That's why your doc will probably keep tabs on your liver enzymes with regular tests. Catching any issues early is key to steering clear of bigger problems down the road. But hey, it's not all doom and gloom. Following your doc's advice on how much and how often to take methotrexate is crucial. It helps keep those side effects, especially the liver-related ones, in check. And if methotrexate's giving your liver a tough time, don't worry, there might be other treatment options to explore. We're all about keeping you safe and healthy, so don't hesitate to chat with your doc if you've got any concerns. 7. Antifungals. Next are antifungals, especially fluconazole and itraconazole. These little warriors are like superheroes when it comes to repelling candida and nail fungus. But here's the thing, they have a bit of a dark side, especially for some people. Yes, in some people, these antifungal medications can cause trouble for your liver. So if you're using them to treat that pesky fungus, keep your eyes peeled for any signs of the liver problems we talked about earlier. 8. Methyl Dopa. It's a go-to med for keeping high blood pressure in check, and get this, it's even considered super safe, especially for pregnant women dealing with hypertension. Yep, methyl dopa, despite its overall safety, has been known to stir up trouble for your liver. So, if you've got any liver issues already, this might not be the best choice for you. Plus, here's the kicker, those liver problems could pop up as late as 12 weeks after you've started taking methyl dopa. That's why it's super important to keep tabs on how your liver's doing if you're on this med. We're all about keeping you healthy and happy, so if you've got a history of liver woes, don't hesitate to chat with your doc about some safer options. 9. Antipsychotics. Risperidone and quetiapine, also known as Seroquel. These are some heavy hitters when it comes to tackling psychoses and tough cases of depression. Yep, both risperidone and quetiapine have been known to mess with your liver, mainly by messing with something called drug-induced cholestasis. Basically, it's when the flow of bile from your liver gets all out of whack. And trust me, bile's crucial for digesting fats and getting rid of waste. So, when these meds start messing with that process, your liver can take a hit. Keep an eye out for any signs your liver might be sending your way if you're on these meds. We're all about looking out for you and keeping you safe and sound. If you've got any worries or questions, don't hesitate to reach out to your doc. 10. Paracetamol. Paracetamol, it's a big player when it comes to messing with your liver. Usually, it's not the regular dose that causes the problem, but when folks go overboard. With its popularity, some end up abusing it instead of sticking to what's recommended. Like, imagine popping 3 for a headache, not a good idea. And if you do repeat that overdose, let me tell you, it's serious stuff. Sure, doctors give it to babies for fever and pain, no problem. But once you cross that line, things can get dicey. See, more than a third of liver failures linked to meds are because of paracetamol. An overdose? It can lead to acute liver failure, which is no joke. Often, it means a transplant if your liver can't bounce back. Unlike kidneys, where dialysis can give them a breather, once your liver's in trouble, it's usually transplant time. Here's a heads up, booze, genes, and even other meds can team up with paracetamol to mess with your liver even more. Symptoms usually kick in 1 to 3 days after you've taken it, with things getting real about 2 to 4 days later. There's an antidote, though, acetylcysteine or Flumucil. It's a lifesaver in paracetamol ODs. But hey, if you've gone overboard, hit up the ER pronto. It's better than risking a transplant, right? Remember, just because a med's not on the list doesn't mean it's liver safe. The liver's like your body's super filter, and messing with it can mess up everything. So, let's be smart about what we pop, and hey, if you found this video helpful, spread the word. We're all about keeping you in the loop.